in terms of the agenda, what we're looking at today, going to briefly look at the anatomy of the eye and at ophthalmic specialisms and eye tests, because it's helpful when dealing with these claims to have a bit of the background as to what the experts will be talking about in the anatomy and the kinds of tests and investigations that an optician or an ophthalmologist would be performing. And we'll then be moving on to looking at some of the common types of claim, including management of post-operative complications and delayed diagnosis. And then finally, to finish with, we'll be looking at some of the strategy and tactics that you might be wanting to think about when running claims of this nature. So before we go on, just a health warning from me. I'm not medically trained. I'm a barrister rather than an expert medic. In all of these claims, of course, it would go without saying that you would take all your medical advice from your medical expert. So what I say in this presentation is by way of very broad background, just to build some familiarity with the sort of concepts that you come across in these claims. But of course, always defer to your medical expert and always take what they say as the starting point for how you build or defend the claim. The next delayed diagnosis scenario that we're looking at is acute red eye. So red eye is a very common condition and it's usually benign. So it's associated with things like conjunctivitis, which is quite a common condition and it's easily treated and not usually particularly sinister. But there are a number of conditions which are serious and can be overlooked because it is something that GPs or optometrists see on a daily basis. So patients with more acute pain or more acute visual loss, that should be a flag to anyone looking at someone presenting with red eye that it might be something more serious requiring referral. So there are 4 on the slide: acute angle closure glaucoma, acute uveitis, and certain types of infections, so bacterial keratitis or herpetic keratitis, can all begin with symptoms of red eye. And the GP or the person looking at it in the first instance needs to know when to suspect and refer for these kinds of conditions.